In this video, we're going to describe the 6 photographs that are required for Chrome Guided Smile. 3 are full face, 3 are intraoral. We'll capture each one and we'll discuss a little bit about the picture itself, why we take it, how to take it, and then we'll discuss some pitfalls of dental photography. So why are these photographs so important? Because when the records come in that are incomplete or incorrect, they delay cases. And cases that are delayed make you unhappy and your patient unhappy. So we like to make sure that the photographs, the STL files, the DICOM are perfect, and this video is going to help you take the right photographs. In addition to this video, we also have a very robust, helpful website for you to print off, among other things, our records. We have record checklists for every situation. Single arch, double arch, edentulous, double edentulous, etc. It's a checklist that just spells out exactly the records we need. And on every single one of these checklists is the grouping of the photographs that we require for Chrome. So the first series is full face photographs, and we want 3 pictures. One is full face, full smile, full face exaggerated smile, and then a profile picture. Profile pictures are usually for lip support, class 1, class 2, but let's get a profile picture and send it. So one of the first things you want to do is make sure the patient is oriented properly for the photograph. Now, a lot of patients are used to glamour shots, selfies, that kind of thing, so they're often looking up to the right or the left. And what you really want to do is make sure that the patient is looking directly at the camera and that the chin is not down and that the nose is pointing right to the camera. And so there's 2 things at play here, right? One is the patient's face, the other is the position of the camera. So have a look at the patient, make sure that through the camera you can see the ears are about the same, you can see about the same amount of the ears, so you know they're looking right at the camera. And then you also, a little trick, you can put the eyes in the middle of the orbits, but the most important thing, looking at the camera, ears are about the same size, and then you ask the patient to smile. And often with these patients who've been suffering, they're not going to give you an exaggerated smile. That's okay. That's our first picture. The second photograph will be an exaggerated smile. And patients usually in this condition that we're doing these cases in, they've not had an exaggerated smile in a long time, so it could be a little tricky. So make something funny, something lighthearted, and try to get the patient to do a full smile, and then try to get them to maintain the same position. So full smile, we want to see the transition line in the future prosthetic, right? So we want to make sure we see where that upper lip is extended the most, so a full smile. And then the third picture, we will have the patient stand sideways profile and still keep the chin up. This one is not quite as critical as the rest because we're not going to do a smile simulation with this picture. And just take a couple of photographs at a profile, and those are the 3 photographs that we use. Now that you've learned to take the perfect Chrome photographs, let's talk about some pitfalls. We see many photographs at the laboratory, and there are always some little things that go on during these full face, full smile pictures. Often the camera is too close, and we have it bracketed, just with the face here as opposed to the full head, because we want to make a nice smile simulation that we can present to the patient. Another common one is that we're using a cell phone, and the cell phone's lens is right up at the top of the camera, but often the camera is positioned a little bit too high. So just be aware of where the lens is on the camera and position that at the level of the nose, and that way we can see the plane of occlusion. That's why you want the camera at the nose. We can see the AP. Another is often photographs are taken full face in the chair, and then a patient is kind of usually contorting to look over to the camera, or they're tipped down, and then they have little chin going on that they don't like. It's tough to make a smile simulation that way, and then often even the musculature, gravity, everything is just different when a patient is lying back in a chair. So standing up against a wall, horizontal, just like all the parameters that we discussed, are the best photographs. The next 3 photographs are the intraoral shots. And with intraoral, we want to capture them with the lips retracted and the patient in occlusion, in centric occlusion. Now, if a patient has a partial denture that's holding them open, and that's the bite we're going to use, then capture the photographs with the partial seated. The goal of the photographs is that we have nice intraoral shots with a nice depth of field, and so that we can match the mounted casts with the photographs to ensure the bite's perfect and the mounting's perfect. So retracted photographs, these are retractors, and really the goal is just to move the lips and the cheeks out of the way so that we can capture these photographs. So, all right, so you have the patient, and you could have the patient practice before to make sure they bite into a habitual bite, but you'll just simply hold the cheeks back, and then you'll see the 3 photographs that are needed for chrome. There are a couple of pitfalls with intraoral pictures. One is the retraction isn't pulled back enough. The other is we don't get a nice picture that's at about a 45. We get too many that are aimed straight on. Really like to have a nice picture from the labial, from the buccal side. But also, we like to have photos of just the anterior with the teeth together. Often we get numerous pictures of occlusal photographs, intraoral photographs, smile photographs of patients out of occlusion. We really don't need any of those photographs. This is just to check articulation.